topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
Noon, Arizona and New Mexico. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. You know, I get a lot of emails, people saying, do you ever read my email? First of all, I read every single email. I don't miss one. And you have been asking for a show topic on stem cell. And there's so many people who do not understand stem cell, but we haven't had an opening up until just recently. And we found one of the greatest experts in the field of stem cell, Dr. Jason DeLuigi. I am so excited about this show. Good afternoon, Jason.
Hello, how are you today?
We're doing great. Listen, I appreciate Jason just got back off of vacation, and now all of a sudden we're throwing a brand new show at him, but I know he's going to do extremely well. Jason, we have got a huge audience on TikTok and YouTube right now, because those are the only ones that literally show us. Tell us about Life Renewing Stem Cell.
Yeah, so it's a company here that's in Phoenix. Scottsdale is where our clinic's at, so the Phoenix-Scottsdale area. And we see patients that are looking for other alternative treatments that are traditional treatments. Many times those patients may have failed traditional treatments, or they're trying to look for something that might be more natural to do, from that standpoint. There's been, a big push over the last few decades for more natural and holistic medicine, and avoiding some of the deleterious effects of other medical treatments and side effects. So sometimes they look, for regenerative medicine, acupuncture, naturopathy, homeopathic medicine, and the different options. So we're part of that overall field, and so we are mostly we do various treatments here, to help. Different conditions. So,
well, you just said regenerative medicine, and all of a sudden, everybody's writing, "What is regenerative medicine?"
Yes. So regenerative medicine is it's been coined back in the 90s. When there was a provider, Leland Kaiser, had talked about this in 1992 about stem cells and regenerative medicine. So talked about this term. We're trying to look for ways to help fix things. So when you look at even with the NIH and the National Library of Medicine, right? When they define regenerative medicine, right? Our body has the ability to heal itself, right? So you look back at ancient times and stories such as Prometheus, when he's regrowing portions of the liver as the birds pick off his liver, from that standpoint, in the ancient stories from that standpoint. We know the liver regenerates, so we a salamander or a newt, if they lose a limb, they regenerate their limb, and we don't get to that point, but if you get a cut on your finger, I'll always talk about your fingertip being cut. Many times you don't need stitches or even a Band-Aid, and all of a sudden, your skin heals, your fingertip, your fingerprints are still the same, You have blood flow there. You don't have a dead end of your finger, right? And you didn't even need anything more than your body's healing ability. So when times, when we talk about regenerative medicine, it's ways for the body to help heal itself, right? So the body has an innate ability to heal itself, but there may be a misbalance or mismatch that's causing that body not to do it, right? Sometimes it's poor blood flow, sometimes it's poor nutrients, sometimes they need additional cells, right? Or the damage is too much. So what we try to do is give our body the best to regain homeostasis so that they can help heal itself.
Tell me, what type of patient comes to your office? What kind of health issues do they have?
Yes. So I'm predominantly a sports medicine, physician, from that standpoint, and also, pain. So I look at people with pain and functional, recoveries, right? But regenerative medicine is beyond that, right? So, there have been treatments and studies that have been done where they've regrown liver and put, and transplanted a portion of a liver. They have regrown a lobe of the lung and utilize that for transplants, right? So, they're talking about, islet cells for pancreas, to help with diabetes, so there are many different various treatments. My primary focus is, in the, musculoskeletal. So a lot of people come and see me for tendon, joint, muscle injuries, from that standpoint, things like arthritis and tendonitis, what it was one of the things that we see a lot of, from that standpoint.
Well, and do you get into functional medicine?
Yes, I did mention functional medicine, and so what I tell many of my patients, I probably told every single one of them today, right? In other specialties, they talk about adding years to your life. I talk about adding life to your years. So while we're here, I want you to be able to do as much as you want to do. And I don't want the pain or the fear of pain keeping you from doing that, right? So to me, that's functional medicine. So our goal is to decrease pain and improve function so that you can get back out doing the things you want to do in life.
You hear so many stories about people with acute pain, and they go to their family doctor, and basically the family doctor kind of throws his hands up and I don't know what else to do. When they come to you, it's a whole different story.
Absolutely. I was actually telling a student today who was asking me questions about this, is like, what kind of drew me into this field, so when I was back in the Army, I had the Army scholarship to do medical school, and I went back and served my country after doing that. And so, I was doing the clinic, and, a lot of the times, when you're doing orthopedic surgery, they look at what you can do for surgery. And if you're not a surgical candidate, they said, well, you're not a good candidate for surgery, go see somebody else, right? So, and I went and did a physical medicine and rehabilitation rotation next. And many of those same patients, as at the same hospital, I saw them again, and they recognized me from the last month, right? And so when I was learning from some of the other physicians about what you can do other than surgery, we are telling them there's nothing they can do in one clinic, and the other one was like, well, there's 10 things we can do, right? And so it really kind of changed my perspective on how I wanted to do my training and how I wanted to, live my practice. So I went, when I did, finish my residency in physical medicine and rehabilitation, then doing a sports medicine and pain fellowship, that was able to kind of give me, and that's where I added in a lot more of the regenerative treatments, and I brought that back to the military, a couple of decades ago now.
Jason, I'm looking at the questions that are coming in, which is amazing. This is your first show, and we're already getting this many questions. I'm going to kind of take 5 or 6 of these questions.
Great.
A lot of people who have knee problems, and they've been told by their orthopedic surgeon they need a knee replacement. And they're saying they have heard with your type of medicine that you have actually saved people from having to get surgery. Is that true?
Yes, there have been studies that have shown in many personal patients, who where they have come in and been told there's nothing else they can do. They need a knee replacement. And, some of those patients, there's one I'll talk about specifically because he's somebody I remember quite vividly. He had been told by multiple surgeons that he had seen he needed a knee replacement. And he had actually heard that we might be doing this. And he had other friends and relatives who've had surgeries. Some of them had good results. Some of them had okay results. Some of them had complications. Some of them had infected joints and had that. So he was scared about doing it. And he's like, you know what? Once I make that decision to get my knee replaced, maybe I'm going to miss out on other things that might develop over a future time, right? So, and he had heard that I was doing these types of treatment, and I was at Georgetown University at the time, and he had come from Delaware and traveled out of state to come see me. And had asked about it and wanted to know if he was a good candidate. And so we talked to him. And so we did his treatment, and he was doing great. He got a dog. He started walking 6 miles a day. He lost 60 pounds. Everybody started asking him, what did he do? And, they just figured he got a knee replacement. And he was like, no, I went and got regenerative medicine treatment with Dr. DeLuigi, and I'm doing great. And so he started referring patients. And there was actually one day where he actually brought a caravan. He rented a minivan and had 9 patients in it. My entire day was nobody but he brought to the clinic, from that standpoint.
Wow.
And, we treated shoulder pain and knee pain and hip pain and back pain, with all of these. So, from that standpoint. So, but for him, it saved him, right? He ended up moving from the Delaware area to Florida, 5 years later. And he said, I don't need another one now, but I don't know anybody else that's doing this yet. And I trust you. Can you redo my knee? Right. And I ended up, following back up with him 3 years later, and he still hadn't had a knee replacement. So somebody where every surgeon he went and saw said, you need a replacement in the next year. He's was at least 8 years out. And, if he still hasn't had it done, he's at least, 15 years out, so from that standpoint.
Amazing. Here's from Santa Fe, New Mexico. Hey, I'm really enjoying your show. I can't believe there's not more shows out there like this. Or think that AI will be helping his practice.
No, I still think there's too much that comes from the patient and physician experience that comes from that. I can tell more by asking the right questions with patients and then looking at their chart and knowing more, right? When somebody says they come in with back pain and numbness, right? It could be from the back pain, right? But you want to make sure it's not from something else, right? Because if you do treatment for the back and it really wasn't coming from their back, right, then you didn't do much benefit for that patient, and there's a chance that you created harm, right, if something went wrong, right? So the key to that is knowing what the right questions are to ask people, right? You want to try to turn over every stone to make sure they don't have some early stages of diabetes or thyroid problems or B12 deficiency that's causing the numbness, or maybe even a pinched nerve in their foot because they're tying their shoes too tight, which is, anterior tarsal tunnel syndrome that we used to see in military recruits all the time, So these are one of the things that you'd say, before I'm going to try to, do a treatment injection or a surgery for their back, let's make sure that everything's there. And I don't know if AI is going to ever replace that human element. There's going to be a lot of things that AI can improve, right? That can make things easier as far as documentation and the busy work. But I think that's just mostly going to free up providers so that I can see more patients and I can spend more time with patients and getting to ask them the questions that we need to ask to get to the bottom of things.
Well, our Santa Fe listener wants to know, is your practice open on Saturdays?
Right now, they're not. that would be something that we can talk, if there is a bigger push where we're going to have more people coming in from out of town and they don't want to take days off from work, we can definitely look into that, whether it's, it's one weekend where we do it per month, right? And try to get those patients in there. But right now we're currently not open on Saturdays. Sorry.
Hey, Jason, what is prolotherapy?
So prolotherapy, I always say this was somewhat the precursor to the regenerative medicine push. It started in the late 1920s, early 1930s. So a lot of the practices then, they were using what was considered traditional medicine at the time, right? They're using mercury and they were using leaching and things along those lines. But a lot of it, is anti, right? So when you have a cough, you take an anti-cough. When you have diarrhea, you have anti-diarrhea. When you have inflammation, you have anti-inflammatories, right? So, but why is our body having you cough or sneeze? Why is our body having you have diarrhea? Well, it's trying to get rid of something that's a foreign, right, that it doesn't like, right? So same with inflammation, right? Our body's inflamed maybe to kind of help heal that area. And if we're taking anti-inflammatories, we may prevent that from healing. So in those early times, they started using a chemical irritant to create pro-inflammation, right? So they used a high concentrated sugar water called dextrose. And there's different concoctions you can do now. Some dextrose 50, you can mix it with lidocaine or normal saline or sodium morulate or B12. There's a number of different things you can mix with it over time. But it's a pro-inflammatory treatment, right? So it was counter to the times where everything was anti-inflammatory. So you speed forward to the 1990s when we're talking about stem cells and regenerative medicine and PRP, platelet-rich plasma. Those all can potentially cause, your body's own, inflammatory response, so it can create that healing response. So prolotherapy stands for proliferative therapy. And and there's been a number of studies that have shown to have been effective. And there was actually recently, a clinical trial run by Mayo for knee osteoarthritis with prolotherapy that was being run by Dr. David Patchett, a colleague of mine that I've worked with in the past. And I'm looking forward to seeing if they publish that, because I know that there's been other studies that have shown prolotherapy has been helpful for knee osteoarthritis, sacroiliac joint, and many other things. So.
I got to tell you that we did a lot of promoing of your show about stem cell. So we're getting a lot of questions, people wanting to know, what is stem cell?
Yeah, so stem cells there's different types of stem cells. There's blood-borne stem cells, are also known as hemopoietic, and that would be your platelet-rich plasma. Now, some people will say they're no longer stem cells because your body is now differentiated them. They decide they know what they're going to be when they grow up, right? So they're red blood cells, white blood cells, platelets, right? Where there's bone marrow derived stem cells, so we're getting it before they become differentiated, right? So they're undifferentiated cells you can harvest from your bone marrow. There's fat stem cells, also known as adipose-derived stem cells. So we all know that we burn fat for energy, and we also use it for building blocks, right? And then there's been over time, they started using the placenta and umbilical cord, right? And taking it from Wharton's jelly so they can get, umbilical cord, day zero cells, right? That can be used from that stem cell. So they're basically building blocks that our body uses to help heal. So it all begins with that, platelet, laying down and working as medicinal signaling cells, or MSC, that stimulate other cells to come. So and build on that healing cascade.
Well, here's a kind of a sad story, Jason. One of our viewers said that he went to Mexico for stem cell.
Yes.
And he's had so much trouble, and he knows it wasn't the stem cell, it was the doctor that performed stem cell. And he said, I'm so glad to know that you're right here in the Arizona area. Yeah. So that's wonderful. So who is a candidate for stem cell?
Well, there are different patients, different types of patients that could be candidates, right? I would say a candidate would be somebody who has a problem, right? And they've been trying traditional methods that haven't been effective for them, and they're looking for other natural ways to help, heal themselves or get themselves better, improvement of pain and function, right? Also, patients who might be, leery because they know of other patients who've had complications, right, from other treatments, and they're looking for something that, is going to tap with the body's innate ability to heal itself, right, and looking more to, to build on homeostasis and, and a more natural approach to healing, So there's the candidacy, is varied. Sometimes people want to come in and talk about, stem cells for longevity, right? I hear that this can, if I get stem cells, it can help with me, right? Other people have a specific problem, right? And then I try to work with you, and same with my colleagues, right? We see you, we talk to you, and see if you would be a candidate, and what approach may be best for you.
I don't know if this will surprise you or not. I've been doing this for 17 years, and we have done shows all over the country. Right now, Jason, the top 3 topics, and we do legal and we do financial, but the top 3 most requested topics are longevity, functional medicine, and stem cell. Does that surprise you?
No, I think it's growing right now in the field. I think it's been off the radar for a while, right? And a lot of people have been word of mouth, right? From that standpoint, there's still so many patients that we come in, that will say, I didn't know enough about it. And some people just want to come and learn about it, and so they can learn more. And other people, I didn't know much about it, but I know X, Y, or Z, or Tom, Bill, or Sally who had it, and they're doing great. And they told me that I should come see you, from that standpoint. And so, one of the, when this opportunity came up for me to, be on the show and get to talk to your audience, right? It's a lot of people, sometimes they're scared to ask those questions, right?
Yes.
They feel uncomfortable coming to a doctor, and they don't know what they're going to get, and they don't know if they're going to get pushed into getting something that doesn't work, right? So this is one of my great opportunities. I always tell people, you're coming from a regenerative medicine consultation. We're here to talk to you. If this works for you, great. If you're not sure about it, think about it, right? If you want more, right, that's where you can't make an informed decision if you don't know about it. So don't hesitate to reach out, make a consultation, or call for questions.
What's the best way to reach your office, Jason?
So, our phone number is 480-401-2554. It should be scrolling at the bottom here. So it's 480-401-2554. We're also on the internet at Life Renewing Stem Cells. And then, and I believe that might be shared as well. And so, and then there's also, sometimes we'll have educational seminars in the Valley here, in the Phoenix Valley. So there are some advertising flyers that go out, and we have a seminar team that will do some dinner talks. But, from that standpoint, if you saw one and it sparked your memory that you got one and you wanted to go, they offer those talks there. But the best way of coming in is come and seeing, one of our providers and talking. The seminar people will just do a regular talk, right? But, I can talk to you more specifically about medical conditions and so we can individualize and tailor treatments to you.
Well, first of all, I want to thank Travis. He has been wonderful. And I got to tell you, I am so glad we have you. And I can't wait till our next show next month.
Thank you. It's been an absolute pleasure. And I hope this was helpful for your audiences. And I'm looking forward to the next show as well.
The numbers are amazing for the first show. Thank you so much, Jason. We'll see you next month.
All right. Take care, Steve-O.
You too. That's Dr. Jason DeLuigi. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.